Correction claw finger. Other methods. The superficialist technique involves splitting the flexor digitorum superficialis of the long finger into 4 slips. One slip is passed through the lumbrical canal of each finger to be inserted into the radial lateral bend of the dorsal apparatus. This slip is sutured with the wrist in 30 degrees palmar flexion, the MP joints in 80 to 90 degree flexion, and the interphalangeal joints in full extension. In the dorsal approach, the tendon slips of the extensor carpi radialis brevis are passed superficial to the dorsal carpal ligament, through the intermetacarpal spaces, through the lumbrical canal volar to the deep transverse metacarpal ligament. The tendon is attached to the radial lateral bends of the long, ring and little fingers, and the ulnar lateral bend of the index finger. A modification of the latter procedure involves detaching the extensor carpi radialis longus at its insertion and passing it deep to the brachioradialis to the volar sides of the forearm proximate to the wrist. The grafts of the plantaris or palmaris tendons are used. The lateral bends are identified through dorsoradial incisions over the proximal phalanx, except the index finger, which has the ulnar lateral bend exposed. The tendon slips are directed through the carpal tunnel volar to the deep transverse metacarpal ligament and into the lateral bends. The tendons are sutured with the wrist dorsiflexed 45 degrees, the MP joints are flexed 70 degrees, and the interphalangeal joints are fixed at 0 degrees. Incisions are closed. Correction, hammertoe, e.g., interphalangeal fusion, partial or total phalangectomy. Hammertoe describes an abnormal flexion posture of the proximal interphalangeal joint of one of the lesser toes. Conservative treatment is usually unsuccessful. The physician makes an elliptical incision over the proximal interphalangeal joint 5 mm to 6 mm wide. A portion of the extensor tendon and joint capsule under the skin is removed. The collateral ligaments are cut to allow the toe to be flexed to 90 degrees. The head and neck of the proximal phalanx are removed with a small power blade saw and the ends of the bones are smoothed. The toe is checked for ROM and the extensor tendon is reattached and the incision is closed with sutures. Correction, cock up fifth toe, with plastic skin closure, Ruiz-Mora type procedure. An elliptical shaped incision is made in the skin under the fifth toe. The soft tissues are reflected to expose the underlying structures. The proximal phalanx is removed, leaving a space between the base of the metatarsal and the distal phalanx. The deep tissues and skin incisions are closed with sutures. Correction of everted punctum, cautery. The lacrimal system serves to keep the conjunctiva and cornea moist through the production, distribution, and elimination of tears. Tears produced by the lacrimal gland are released into the eye through the lacrimal punctum, a small opening in the inner canthus. The physician administers a local anesthetic at the lacrimal punctum and applies bipolar or monopolar cautery to the palpebral conjunctiva just below the level of the inferior punctum. The result is a repositioning of the punctum itself.